Today's webinar is informational. It is to give you as much information as possible about the new E2E exam and the CoreCHI-P credential or CoreCHI Performance credential. Let's start with the first question or a series of questions that address the naming convention. So what's in a name? What do different acronyms behind our credentials and exams mean? Well, let's start with the definitions. We're interpreters, we're all about words. Credential versus exam. Credential is a bigger concept. Credential confirms that you met the eligibility requirements, such as age, education, healthcare interpreter training, and language proficiency. Credential confirms that you passed one or two certification exams. And credential is valid for a limited number of years, and it includes renewal requirements. When we talk about exam, in CCHI's programs, exam sometimes can have the same name as the credential, but sometimes that name may be different. An exam must be taken within a specific time period. It follows specific retake policy, and each exam has slightly different retake policy. And if a credential includes two exams, then after passing the first exam, you cannot have that credential. You have to take both exams to receive a credential. Exam is a component of the credential. When we talk about CCHI certifications, CCHI credentials, or CCHI certification credentials, as you can see, all these three words I use as synonyms. We talk about two tiers. The CoreCHI is the CoreCHI certification of a knowledge tier available to interpreters of most languages. And then there are two credentials on the performance tier, CoreCHI-Performance or CoreCHI-P, and CHI Arabic, Mandarin, and Spanish. As we move forward in our development of the programs, of the certifications, we plan in 2025 to start phasing out the CoreCHI credential. We'll still keep the exam, but the credential will be phased out in the format that it exists today. So let me now go and compare these three credentials and see where they are similar and where they're different. So you can see at the top here, there are three credentials, and we'll start with the questions, which exams do you need to take to earn these credentials? For the CoreCHI credential, you only have one exam, and the name is the same, CoreCHI exam. For the CoreCHI Performance credential, which is new, which we're just launching this year, this month, you have to take two exams, CoreCHI exam, which will test your knowledge, and a monolingual performance exam, which is called E2E. E2E is an acronym standing for English to English, reflecting how we are delivering it in a monolingual format. And then the CHI credentials, Arabic, Mandarin, and Spanish, are bilingual credentials, and they include also two exams, knowledge CoreCHI exam and bilingual performance CHI exam. So that's about like what do they consist of, these three credentials. Now, who can get these credentials? CoreCHI, let's start with the first one, which has only one exam. All interpreters except Arabic, Mandarin, and Spanish. These three languages cannot get the CoreCHI credential. They have to jump to the CHI Arabic, Mandarin, and Spanish credential. Why? Because we believe that ultimately we can test and assess the preparedness and qualifications of an interpreter only when we can assess both knowledge and performance. And we have three exams for performance exams. That's why you have to go to this credential. Now, the new credential also has a performance component, and that's why it's available to interpreters of any language. But there is a difference, right? Monolingual versus bilingual. And that's why interpreters of Arabic, Mandarin, or Spanish can earn CoreCHI performance credential, but only after they get the CHI Arabic, Mandarin, and Spanish credentials. In other words, if you're a CHI interpreter right now, already certified, yes, you could get CoreCHI Performance. And I'll talk about why you may want to do that, but why you don't necessarily need to do that. What do you see on the certificates for these credentials? The CoreCHI certificates, you don't have any language listed. You just say that you received the CoreCHI certification verifying your knowledge about the healthcare profession and meeting our eligibility requirements. For the both CoreCHI Performance and CHI certifications, you receive the language listed on the certificate. Now, let's talk about exams. So there are 3 exams: CoreCHI, E2E, and CHI. That's how the word E2E comes in, and I understand it may be confusing. Why is it not called CoreCHI-P? Well, the reason is we started developing it through the testing study. When we developed the blueprint for the current E2E exam, we want to connect it to that study that we conducted in 2020, because that study gave us the scientific foundation for this new exam, and we want to make sure that we show continuity between the study and this new certification exam. But the credential has a different name. As far as when you can take this exam, CoreCHI exam, you must take within 6 months, otherwise you'll have to pay again. E2E and CHI exams, you have 12 months after the date of passing CoreCHI exam. If you don't do it within 12 months, you'll have to retake the CoreCHI exam before you can take these 2 exams. Can the exams be taken online? The answer is yes, only for the knowledge exam, because it's a multiple choice exam that could be delivered online or at testing centers. Both E2E and CHI exams are audio capture or audio output exams, and for security and technological reasons, they cannot be administered online in a manner that would mean accreditation requirements for CCHI. How long is the exam? CoreCHI exam, you have 2 hours, but for both performance exams, you have 1 hour to complete them. And when do you get the scores for these exams? For the CoreCHI exam, scores are available within 48 hours. They're emailed to you, but right there on the testing center, or after you complete the exam online, you will see if you passed or failed. You just don't know with what score. As far as the scores for performance exams, because they are produced by human raters and they take time to rate their exams, you receive your scores within 6 to 8 weeks after the last day of the testing window. Since we're talking about the names, your name on your current valid ID must match the name on the email that is called notice to schedule that you will receive, because if it doesn't match, you will not be admitted to the test center and you will not be allowed to test. And since some of you earned the CoreCHI credential several years ago, things have changed, your names have changed. Make sure that you email us at apply@cchicertification.org as soon as possible, but definitely at least 5 business days before your scheduled testing day. That applies to any exam. The timeline, the questions is, how long does it take to do things? Now, if you pay for E2E exam this week, you will get the notice. You will get the notice to schedule next week, and you will have until, I would say, realistically, you should schedule your exam by April 5th, because the sooner you schedule, the sooner you get the date and time that you really like. After April 5th, you can still schedule for April 12th if your test center has seats. And that's what we cannot guarantee, right? Because it's first come, first serve for any testing clients, not just CCHI, but people who test for nursing, for architects, for computer science. We all utilize the same testing center of our vendor, Prometric. So that's why, the sooner you pay the fee, the sooner you should schedule, because you'll get the spot that is more convenient for you. Then you'll take the exam during this testing window, March 14th through April 12th. The next testing window we have not set yet, so we'll announce it sometime in May. Then April, May, we'll be scoring it and doing the standard setting, and then we'll release the scores by mid-June. But the date on your certification will be that date of your exam that you took in March or April.